Good evening, all. Hello, everyone. Good evening.
Good evening, ma'am.
Hello. Hi.
Hi.
So nice meeting you all. This is Nandita. So before starting the section, I would like to introduce myself a little. Basically, I'm from Hyderabad, and I'm carrying around 10 years of experience as a dietitian in the same field. So can you introduce yourself? Can you put a message on the group? So where are you from, your name, and please turn on your video and your qualification and all. Harshita ji, I'm from AP working in TCS. Hi, Harshita ji.
Hello, ma'am.
Yeah. AP means Andhra Pradesh.
Yes, ma'am. I'm from Andhra Pradesh.
Okay. This is Harshita and Praveena from Hyderabad. Hi, Praveena ji. Priyadashini, Chennai MBA. Priya from Chennai. Nice meeting you all. And Manisha from Punjab. Oh, good. Amar here. Hi, Amarji from Bangalore. Valanmati from Abu Dhabi. Hi, Valanmati ji.
Hi, ma'am. I did not see the option of this chatting. So I'm from Dubai. Shweta.
Hi, Shweta. Hi. Shweta. Okay. Anyone else? Is there? I'm from Mumbai. Hi, Barvisha ji. Okay, it's very nice meeting you all. So it's very good that people are from South and North and from abroad also. So before starting the section, just I would like to say a few things about the nutrition. So what is the nutrition and why you guys are more interested to learn about the nutrition? And may I know your educational background? And anyone from this group did any yoga course? Okay. Ravina ji, you did yoga course?
Yeah, I'm a yoga teacher too. Yeah.
Okay, good.
Yeah.
You're from Hyderabad, right?
I'm from Hyderabad. Yes.
From Hyderabad, where? Which place? आवाज नहीं आ रही.
I'm from Sainikpuri.
अच्छा, Sainikpuri. Okay, okay. I'm
Yeah.
from Kondapur.
Kondapur. Acha, okay.
Okay, Charan, I'm also yoga
Acha.
coach. Okay, ji. Good. So this course will be for 1 month. And after the completion of the course, you will get a soft and hard copy of nutritional that you did a nutritional course from Studio. And this is lifetime valid. So you will get more benefits with the certification. And in this 1 month course, you're going to learn many things about what is the nutrition, the basics of the nutrition, and along with that, so what are the important points we have to keep in mind while making the diet plans? And nowadays, many people are suffering from many disorders. It includes metabolic disorders, chronic disorders, and old age. During old age, also we are suffering with many disorders, osteoporosis and all. And nowadays, many people suffering from a different type of cancers and gut issues. And this is nowadays people are challenging with these diseases, and without nutritional support we can't cure any disease. So whenever we are practicing yoga, whenever we are doing some any physical exercise or yoga therapy, if you add this nutrition therapy along with the yoga therapy and yoga asanas, you can treat a person completely. This is a completely holistic approach. So nutrition is it plays very important role while treating the patient completely. And for example, nowadays, if we discuss about the women health, many women suffering from PCOS and PCOD. Nowadays, out of 5 women, 1 or 2 women suffering from PCOS and PCOD, that youngest people also 15 years, young teenagers also suffering from this particular condition nowadays because of the lifestyle changes, because of the food habits. So just imagine, so this nutrition plays a very important role in treating a person completely. And we can make a person completely disease free if they follow, if they take a complete like a balanced diet. Okay. In this course, we are going to learn about the balanced diet. We are going to learn completely about the balanced diet because this so this balanced diet is very important to cure or treat any diseases. Okay, so that's why balanced diet. We are going to learn balanced diet and food exchange list, BMI, BMR, and we are going to learn about kids nutrition, pre and postnatal nutrition. During pregnancy also nutrition is very important because during pregnancy what mother eats, after delivery the baby's growth and development depends on mother's health during pregnancy. And generally, every pregnant woman gain 12 to 13 kgs during pregnancy. And what kind of nutrition are very important during pregnancy? Also very important while practicing yoga. And if they have any gestational diabetes, for everything, nutrition only the main. It plays main role to cure any disease. So in this course, you are going to learn all about this. So if you have any queries regarding diet and during the course, during the learning process, you can ask me in the group. Okay, you will get a response, and we can clear any doubts on the group. Okay, because nutrition it's take little more time to learn completely because a regular practice is very important. So whenever we are whenever we are practicing the classes, whenever we are discussing on particular topic, make sure that after the session you should practice about the particular topic because you can't remember everything. For example, for making diet for diabetic patients is not so easy because it's depend on their food habits, their BMR, and they based on their metabolic rate, based on their BMI, and based on their food habits, and based on if they have any hypertension, the diet will be the different. If they have any particular gut issue, the diet will be the different. So first we have to identify what kind of problem they are facing nutritionally. So we have to first clear that problem. After that only we have to introduce a therapeutic diet to the particular person. So just to consider this course as a therapeutic diet to treat a person completely. And from childhood to adult. Okay, from childhood to adult, the diet patterns is completely different. And according to RDA, okay, RDA, recommended daily allowances, our Indians follow National Institute of Nutrition guidelines. Okay, so National Institute of Nutrition, ICMR, they're going to release every year RDAs. RDA means recommended daily allowances. So we have to follow those principles while making the diet plan because for example, vitamin C, how much we have to take per day to reduce stress levels and to improve immunity and to reduce oxidation from the air pollution. For everything, they will provide as a guidelines. So we have to follow that guideline while making the diet plans. So all these important things, important points we are going to discuss in this course. Okay, in this course. And along with that, whenever we are practicing yoga, whenever we are practicing yoga, whenever we are meditating or we are teaching some pranayama techniques to the clients, so make sure that diet plays important role along with the pranayama. For example, if we are going to teach Brahmari pranayama for PCOS, PCOD, so it helped them to clear their problem 50%. So remaining 50%, along with the yoga asanas, we are going to introduce, we should give diet plan also, because particular nutrients plays important role to reduce inflammation from the body and to improve hormone balance in our body. So whenever we are practicing yoga, adding these things, adding nutritional techniques, nutritional principles in the diet, it helped them to cure their condition 100% naturally without any medical consultation. Okay, without medical consultation, along with only the diet and yoga, we can treat few disorders, few diseases like PCOS, PCOD, thyroid, and obesity. Also, we can cure it completely with a good with nutritional principles and yoga therapy also. Okay, so these things we are going to cover completely in this section. So in our syllabus, we have syllabus also like carbohydrate metabolism, lipid metabolism, protein metabolism. So every day we are going to discuss each one topic, and each topic we are going to discuss about the metabolism, about that particular nutrient completely. Okay, completely. And what kind, how many carbohydrates we have to give for particular condition, particular disease also, we are going to discuss in this course. Okay, so I'm trying to teach you everything 100%. So while making the diet plans or while practicing, if you have any queries, feel free to ask me, because making diet plans is not that so easy. We can find many nutritionists on online platform. So they are going to give the diet plan. So we are giving the diet plan. So you can reduce the weight with this diet plan. But we are not like that. We are going to treat a person completely in therapeutic way. Okay, along with the yoga principle, along with the yoga and along with the dietary principles. Okay, so for example, if whatever we are getting the diet plans from online coaches, not all, from few people. So without any knowledge, we can't follow their diet completely, because my diet may not work for you. Your diet may not work for others. For example, if cabbage is suitable for me, but cabbage is poison for thyroid patients, it different from person to person. Okay, that's why make sure that you should practice dietary this assignment daily to get more knowledge about the nutrition. So if you have any queries regarding the diet, regarding this course, you can ask me now. You can ask me now regarding anything, any particular disease. If you want to learn new things, anything, you can ask me now. So we can discuss today.
We will get the notes for everything, right? So whatever we are
Yes,
discussing
yeah.
on the daily topic, so
Yeah.
we'll get on the daily basis, isn't it?
So I'm going to explain in PPT.
Mm-hmm.
Okay. After the during the course and after the course, you will get all the PDF
Okay.
from the management books
Okay.
and all. You will get the PDF. So please keep notes with you, notes and pen with you, because whatever points we are discussing during the course in the class, you may not find that in PDF books also, because PDF clearly will get particular disease, particular and all. So few important points also we are going to discuss in the class. For example, micronutrient deficiencies, for example, 70% of the population affecting with the micronutrient deficiencies. So during the class only, we are going to discuss all about the micronutrients. So you better to make, you better to write down everything, whatever we are discussing during the class. Okay, you can make a note. And during the section, you will get PDFs. After the course also, you will get all.
Thank you. Thank you.
And ma'am, can I ask one
Ma'am?
question? Sorry. Hello.
Okay. Yeah, please.
Can I ask?
Yeah, please.
Yeah. Am I audible now?
Yeah.
Yeah. Actually, how does the background matters? Because for the nutrition course, will this 1 month of knowledge will be sufficient for us for guiding someone with the good dietary plan or whatever it is?
Yeah, but 1 month is not sufficient, frankly. So daily practice make you perfect.
Hmm.
So daily, whatever doubts you have while making the diet plans, you can ask me directly. So it help you to improve your knowledge on nutrition. It help you to know more about the what is a nutrition, what is BMR, BMI. Because while making the diet plans, BMR, BMI plays a major role. BMI is body mass index. BMR means basal metabolic rate. So based on basal metabolic rate only, we are going to give calories to the particular client. And you are going to learn completely in detail about BMR, BMI, and I will teach you everything while making the diet plan. So you can make a diet plan. For example, today, if we discuss about the diabetes, for particular day, assignment is that only. So you have to make a diabetic diet while using dietary principles. Okay.
Yeah, as you said, it is a therapeutic diabetic chart you're going to get there.
Yes.
But
Yeah.
in general, also, will we be able to, analyze something, or will we be able to make a dietary
Yes.
chart where that much
Yes.
of
Yes.
knowledge will
Yes.
be? Yes. Okay.
Yes.
Thank
Hello. Hello, ma'am.
Hi.
Am I audible?
Yeah.
Ma'am, what type of Ayurvedic diet you are giving? Uh, It's mentioned in the advertisement.
What is it? Sorry. Ayurvedic
What
diet.
type of yeah.
So in Ayurvedic diet, the diet will be the different because Ayurvedic treatment is different. For example, in allopathy, for example, for psoriasis patients, in allopathy, we are going to give omega-3 fatty acids. We will give omega-3 fatty acids. That is not restricted food. In Ayurvedic therapy, they are going to give some type of medicine. So for that medicine, if you take omega-3 fatty acids, you may get allergy.
Yes.
So the food pattern is completely different. And
But we are covering that in our syllabus.
in
Ayurvedic diet.
Ayurvedic diet, we are not going to cover. But there is no much difference between Ayurvedic therapy and allopathic therapy, diet therapy.
Okay.
So this nutritional course is sufficient for you. You don't need to learn separate Ayurvedic nutrition course because only few food restrictions only will be there. So while we are learning the course, you can know more because omega-3 fatty acids, for example, omega-3 fatty acids is not recommended for everyone. Those who have gut issue, they may get allergic. So in Ayurvedic course, they are going to suggest you not to give omega-3 fatty acids. So that is only the difference. So we are going to discuss that also in the course in detail. So you don't need to worry about that. So this diet is sufficient for everything. Homeopathy, allopathy, Ayurvedic, Unani. For everything, it will be sufficient.
My question, ma'am. Just
Yeah.
want- may I know, like, who's going to take the sessions, all these sessions, and who is going to take our sessions? Every 8 to 9 we have session.
Yeah, 8 to 9 we have section. I will be the person.
So, may I know about your qualification, ma'am? What you?
Yeah, I did masters in nutrition dietetics from Sri Venkateshwara University, Tirupati, and I'm carrying around 10 years of experience as a dietitian. I'm also yoga teacher.
And one more thing, ma'am, what you're going to, how you're going to go for all the classes? Like we have this 1 month duration. So what will be the steps? आप कैसे cover up करने वाले हैं? How you going to cover the things? How you are going to?
First, we are going to cover the basic things like carbohydrate, proteins, fats. That are the macronutrients. So what are the macronutrients role to prevent any disease, or why we require macronutrients in larger amounts. So by the time 1 day carbohydrate, 1 day protein, we are going to discuss first macronutrients, after that micronutrients. After these two sections, we are going to discuss fat metabolism, because fat also very important. After that, we are going to discuss about therapeutic diet, diabetes, pregnancy, postnatal pregnancy, lactation, kids nutrition, gut health, because nowadays gut playing a major role. Many research is going on gut health. So 90% of the diseases are born from the unhealthy gut. So we are going to discuss about gut health completely, because if you understand about the gut, you can make any diet plan so easily. For any patient, to treat any patient, you had to make their gut health first. We had to reboot our gut health. So we are going to discuss that also in this course. Everything step by step, from basics to therapeutic. We are going to discuss the complete course in a month. You don't need to worry. You will learn everything in this course. If you have any queries regarding the diet while making the diet, you can ask me anytime, because diet is different from person to person. Always remember that. For you, diet is different. For me, diet is different. Okay. This is completely different from person to person. So you can learn these things in this course, and you can make it your own diet plan with dietary with using dietary principles. Okay.
Ma'am, you will tell about Vat, Pitta, Kapha also? How to identify when
Uh,
something is going on?
yeah, if you want, I will teach you that also. In yoga therapy, you can learn in detail about Vata, Kapha, Pitta, the body types. If you
Okay.
want, I will teach you that one particular session. Um, uh, we don't need Vata, Kapha, Pitta learn more. But so if you have excess heat in your body, that simply that because of vitamin B deficiency. So of course, so based on your complaints, we can identify the problem.
Okay, ma'am.
So that Vata, Kapha, Pitta basically in Ayurvedic therapy they will use. That is also very important. If you know more about Vata, Kapha, Pitta, you can gain more knowledge. You can treat a person completely. So definitely we can discuss one day about that.
Yeah, ma'am, please. Please, sure, discuss. I want.
Yeah. Okay. Okay.
Hello.
Yeah. Please. Are you-
Hi. Am I audible?
Yeah. Yeah. Please.
Yeah, hi, ma'am. Actually, why I this enter this course, because I thought this will be the Ayurveda, like a Pitta, like you said these things, no? And are you going to teach some, cooking recipes also for this particular nutrition, or only the knowledge? This
Ajib,
was a question.
cooking methods also we are going to discuss, because
Mhm.
cooking methods are very important. So we are going to discuss what kind of vessels we have to use while cooking, what kind of nutrients you are going to lose if you cook more time, how much water we have to use while cooking, and what water balance also in body, what how many liters we have to consume. Everything you are going to discuss, we are going to discuss in the course. And Ayurvedic, completely Ayurvedic is different, allopathy is different. So this is a nutrition course which is useful for Ayurvedic, Unani, all kind of medicine, because without any nutritional advice, you can't treat a person completely. That in Ayurvedic, Unani, allopathy, whatever it is. So this knowledge in this course, whatever you're learning, this knowledge is helpful for you if you work for Ayurvedic sector, if you work for Unani sector, if you work for allopathy, whatever it is. So this course is useful for every medicine. So Ayurvedic, don't compare this with Ayurvedic. Ayurvedic is completely different, but in Ayurvedic also, these foods only they are going to use, and only slightly only difference. the food patterns. And if you're taking any Ayurvedic medicine, what kind of food you're going to take, what food you should avoid, that also we are going to discuss. Okay. Are we going to learn about detox topic as well? Yes, we are going to discuss about detox topic also, because if you are not taking a balanced diet, you can't detox your body fully. Okay, so there is no specific detox drinks, detox foods. Every nutrient help us to detox our body. So we are going to learn that also in detail. Are you working, ma'am? Yes, I'm working. So I worked for with the different hospitals as a dietitian. Currently, I'm taking my personal yoga classes and I'm giving the diet plan to my clients. So I'm currently doing freelance as. I'm working for corporate sector also currently as a dietitian. That is just part time. So any doubts regarding that this course regarding about the course, you can ask me now, because this is a topic.
Ma'am,
Sorry.
at the end of this topic, this course, can we get to know कि हमारे लिए which diet plan is suitable or someone for someone else?
Yes. That is only we are going to discuss more in this section.
Okay, ma'am. Okay.
We are going to, yeah.
Like if one person or two persons having thyroid, means same diet is not suitable for both of them.
Yes.
Okay. The
Both diet is not suitable for both of them, because the diet depends on their BMR and their
okay.
food habits. For vegetarian, the diet is different. For non-vegetarian, the diet is different. And if they follow the same calorie deficient diet, one people may see the positive result, one person may not see the positive result. So we have to check that time their gut health. Okay, so we are going to discuss everything in detail. So while learning, so you can ask me many questions, we can discuss, or you can message me on the group, we can discuss more. Okay.
Okay, ma'am. Okay. Thank you so much.
Yeah.
It's a Monday to Friday class or Monday to Saturday?
Monday to Saturday. And after every class, we are going to discuss, I'm going to give you one assignment. You have to make a diet plan and you have to post the diet plan on the particular group. In the group, or else you can send me personally also. So I can correct you. I will guide you what dietary principles you have to use while making the diet plan for particular person for particular disease. So if you do any mistakes, you can learn more, you can make a perfect diet. So regular practice is very important, and updating your knowledge with the new researchers is very important, because nowadays every disease only happening, only we are getting because of the micronutrient deficiency. Okay, and what kind of vessels we are using, what kind of oil we are using for cooking, how much oil we are using, physical exercise, everything matters to treat a person completely. Okay, so everything matters, everything is very important in this section. So you better to write down everything on the notes. And anyone know about the BMR? So that is basic knowledge. So what is BMR? Basically, what is BMR? So if you're consulting a doctor, definitely they will check your
No,
height
it is
and weight.
us.
Sorry.
Basal metabolic rate.
Yeah, basal metabolic rate. So whenever we visit a doctor, why they will check our height and weight? Why? Why they will check? Why that is mandatory? to check our height and weight in the hospital whenever we visit a doctor?
To suggest the medicine and the amount of medicine which we take.
So what is the link between medicine and our weight?
Dose, ma'am, dosage.
Dose
It's
also why? Okay, it's depend on the
Eh,
age, right? It's
weight,
depend on
it
the
depends upon the weight. More than age, probably the ratio also.
There has to be proportion of
Yeah, it has to be.
weight and even the height.
Yes.
There has to be
Yeah.
proportion.
Yeah, our weight is way too many disorders. So whenever our BMI is under control, whenever our BMI is in normal ranges, so 90% we don't get any chronic disorders and metabolic disorders. So metabolic disorders means diabetes, it includes. Obesity is a metabolic disorder. Obesity is not a disease, but it way too many diseases. Okay, that's why height and according to our height, how much weight we should be. This this monitoring is very important whenever we visit the hospital. Okay, and whenever you see the doctor, they definitely their first question is what food you are eating, how much you are eating. So this is the nutritional therapy. So every disease interlinked to nutrition. So if you're not taking a proper diet, if you're not taking good amount of the nutrients, you can't cure any disease completely. Okay, that's why wherever you go to hospitals, there is a team, dietitian team. They especially work on the kitchen, and they are going to provide a balanced diet, because the diet plays important role to treat the disease. And whenever the patient getting discharged, the every parameters are matters. They check every parameter, because these food we are giving and how much hemoglobin they raised and how much infection got reduced, everything matters. So for everything, nutrition is related. So we are going to learn everything in detail in this course. So if you are getting any clients related to PCOS, PCOD, and PCOS, PCOD is curable with the diet therapy, diet and yoga therapy. Okay, because yoga help them to reduce the symptoms, and it helped them to realize the things. It helped them to cure the disease 70%, 50 to 60%. Remaining 50% depends on the diet what they consume. Okay, so metabolic disorders, lifestyle disorders, and chronic disorders, and cooking methods, and what kind of vessels we have to use, how much oil we have to use, and how whenever we are consuming something, how it is metabolizing, how it is digesting in our body also, we are going to discuss in this course. So particularly we are going to discuss Vata, Kapha, Pitta. Why Vata, Kapha, Pitta are nowadays people are suffering from with these imbalances because of the nutrient deficiency only. For example, kapha body may produce more heat, right? Why? Because the vitamin B deficiency. So if you have good amount of vitamin B in your diet, you don't suffer from kapha body, kapha kapha type. Okay, so whenever we have some imbalances in our body, it's completely depend on the food what we are consuming, how much time you are sleeping, and what kind of like vessels we are using also. It affect on our vata kapha pitta type body type parts. So to cure any this kind of vata kapha pitta also, what kind of food we are consuming also matters. Okay, for kapha, for example, for kapha body, they may not require complete protein. 40 grams, for example, their weight is 60 kg, 40 grams of protein is sufficient for them. But for other type of a body, they require more protein. This is also we are going to discuss. So to treat any disease, protein also important. India is the top most country with protein deficiency. This is second leading country, and metabolic disorder like diabetes, India is the second leading country suffering from diabetes. In by 2050, okay, many researchers are suggesting that by 2050, 70% of the population worldwide may suffer from metabolic disorder like diabetes. Just imagine these metabolic disorders happening only with nutritional deficiencies. Okay. So we are going to cover all those things in this course. Okay. After the course, you will get a certification, and please try to attend each and every class to learn more things, to learn about more about the condition, about the disease, more about the condition disease. So if you attend every class, you can learn more. If you have any queries in the class only, you can clear all those doubts. So that time only you can you are able to make a perfect diet plan. Without proper knowledge, it's little difficult to make a diet plan. So outside whatever that plan, that is different. Whatever we are making diet plan while using with the dietary principles is different. Okay, that's why we will take only official websites, and we only use only dietary principles which is released by National Institute of Nutrition. Okay, Indian guidelines is only follows this, and worldwide we can use World Health Organization principles. That is also we are going to discuss. Okay.
Ma'am,
Yeah,
ma'am,
please.
ma'am, are we going to study about the supplements, protein supplements, or
Yes,
from?
everything. Supplements also. We are going to discuss about the supplements also, because people, those who are deficient with particular nutrient, we can't cure them alone with the diet plans. So supplements also helpful for them. So instead of pharmaceuticals, nutraceuticals are better.
Yeah.
Yeah, nutraceuticals are better, and we are going to discuss every supplement. Okay, protein, multivitamin, how it helps, how protein helps, how
Okay.
for gut, everything we are going to discuss. About supplements also we are going to discuss. Okay.
Thank you.
So anything else, anyone have doubts? So this is the course, about the course, and this is we are going to discuss. And during the course, we are going to discuss few Ayurvedic techniques also, and Ayurvedic body type also. Yeah, please.
Ma'am, I have one question.
Yeah, please.
My purpose to join the course was to learn at the end to prepare a diet chart in a combination, because some people are suffering from lifestyle disorders in a combination. Like say,
Yes.
yeah, one person is suffering just from diabetes, which is a life due to lifestyle disorder, and other person is suffering from diabetes as well as IBS, or maybe diabetes as well as PCOS. So we
Yes.
have to make a different diet chart in keeping the mind the complexity and
Yes.
combinations as well, right?
Yeah, we are going to learn that in detail.
Thank you.
Because, for example, for kidney patients, diabetes doesn't work. Okay, diabetic plan doesn't work. For them, we have to make a separate diet plan. So for kidney patients, we are not going to learn much in this section, because that is completely medical therapy, and we can make a diet plan based on their parameters like sodium, urea, creatine levels. It's completely different pattern. So instead of that, apart from that, we are going to learn everything. But if you have any questions regarding kidney patients, I'm going to explain in detail, but that part is completely different. Okay, we can't cure them completely based on these dietary principles. We have to check their parameters, and if they are on dialysis, the diet is different. If they are not on dialysis, the diet is different. We have to monitor everything. That is a different pattern. So instead, apart from that, we are going to learn PCOS, PCOD, thyroid, gut health, hair fall issues, skin issues, everything we are going to discuss. You can make your own diet plan if you understand exactly what are the dietary principles, and why this particular nutrient is very important for particular condition, why we have to give only that particular nutrient, how does it help them to cure completely. We are going to discuss everything in this course. Can we make clients with this course? Yeah, of course, definitely. So what I observed is many people are pro in yoga. They can teach any asana, they will teach everything in perfect way. They are pro, but they don't know the diet plan. So whenever we are treating a patient, consider them clients or patients, whatever it is, without diet, we can't treat them completely, we can't cure them completely. Definitely, these nutrition diet plans, nutrition tips going to help you to increase your clients. It improves your knowledge. You definitely can increase, you can gain more clients if you have good knowledge about the nutrition, because there is an interlink between this. So whenever you're doing pranayama, you are going to cleanse your lungs, you are going to give pure oxygen to every cell, but that every cell requires protein. So without protein, without your lungs health, good health, how pranayama is not going to help, right? The same. So with this course, you're going to earn more clients if you have good knowledge in the nutrition. What is the difference between dietitian and nutritionist? So dietitian is completely different. They are going to make a diet plans. They are going to work with the hospitals. They study in detail about therapeutic, like masters in nutrition. This is a long-term course. Nutritionist means we are doing this certification course, right? So this is the nutritionist. So in nutrition, as a nutritionist, we are going to learn about the nutrients. Okay, nutrients, about the nutrients, what food, how many nutrients we are getting. That is the difference. Dietitian means they are going to make a diet plan with using nutrients percentage. The both are completely different. Priyadashini ji, yeah. But we can also provide diet plan. Yes, you also can provide a diet plan. So it's take time for you to understand the to learn more about this. And if you want to become a dietitian, you should work with the hospitals to gain more knowledge. Because the hospital, the diet plan is the work is completely different. You are going to learn, you are going to see each and every patient, not only diabetes, if they have piles, if they have any micronutrient deficiency, that going to learn completely in detail when you are working with the hospital. That is only the difference. Dietitians work with the hospitals. Ma'am, are we going to learn yoga therapy also? Yoga therapy, I can't. Someone taking the classes. Ma'am is Ayurvedic doctor. One ma'am is taking the classes from Shubha Yoga. If you want, you can join in yoga therapy, because yoga therapy also very important for yoga teacher. Because in yoga therapy, they are going to teach how many times we have to do pranayama. There is some techniques. There are many techniques in yoga therapy that is completely different. So please join yoga therapy course if you are interested. So because I am also much interested in yoga therapy, I am also learning. Yoga therapy is completely different. So if you have knowledge about the nutrition, if you are learning yoga therapy, you are going to be like more knowledgeable in this sector. Balanced diet for children, how to concentrate. Yes, for the children, the diet plan is completely different. We are going to learn that in detail. Okay. Because kids, what they're eating during adult age, it's going to show in their body and their health condition. Okay. So anything else? So this is the course, what we are going to learn. So this is the particular disease condition we are going to cover. And you are going to, like, with everyday assignment and everything, you can make your own diet plan for your own clients. Okay. And after making a diet plan, make sure that observe your client every weekly basis, how much weight they lost, what is their condition. So according to that, you can change your diet plan. So one diet plan is for weekly once or 15 days once, you can change the diet. So while making the diet plan, we are going to discuss about the food exchange list also. Okay, food exchange list plays very important role while making the diet plan, because any person, they can't eat daily one food. So with the same nutritive value, with the same taste and same calorie, we are going to replace the food with another food. That is the food exchange list. Okay. According to our place, everything, non-veg, veg type, food habits, we have to make a different diet plans to different persons. Okay, today's section is done. So if you have queries, you can ask me now, okay, or else we can meet tomorrow. We can discuss more about we can start with the basics. Tomorrow we are going to discuss about the basics of the nutrition, and after that, complex like carbohydrate metabolism we are going to discuss. For today, the section is done. So any no doubts, right? You cleared?
Yeah, ma'am, I have one question.
Yeah.
Ma'am,